Hello, welcome to this very special episode on iCure. This is regarding the newer possible pandemic, or the newer strains that have emerged in China. And a lot of people are actually losing sleep over this. And today, for our discussion, we have a very important person here, and that is Dr. Raja Dhar. Dr. Dhar is a director and head of pulmonology at the C.K. Birla Group of Hospitals in Kolkata, also known as the Calcutta Medical Research Institute. He's also director of Asia Pacific Alliance for Control of Influenza. And more importantly, he has about 146 publications, has written 21 book chapters, and is on the editorial board of many journals. He has received the Dronacharya Award for continuing medical education in India and the Indira Gandhi Gold Medal for outstanding individual achievement in medicine. But most importantly, Dr. Dhar was the face of the war against COVID in the previous pandemic. Welcome to this show, Raja.
Thank you so much, DB. Absolute pleasure to be here. And thank you for those flattering words. I look forward to this discussion, and hopefully we'll have some messages between us, which would be useful for our audience today.
Yeah, I mean, this is on the back of the events in China, where there's been a surge of cases of COVID, especially when China took away its zero tolerance policy. So what do you think is the implication for people like us who are either living in the UK or India? Are we heading for another lockdown?
So that's a very interesting question, and I'm glad you have phrased the question the way you have, because I think we are talking of the two most populated nations in the world, in India and China. We'll talk about the UK too, but we are talking about vast populations. And the attitude of the two countries, the governments and the people in the two different nations couldn't have been more different, right? Be that for political reasons, geopolitical reasons, for economic reasons, the attitude was different. So China, as you said, adopted a zero COVID policy. So if you think about the scenario in China, in the last 3 years, when the pandemic has raged on with small intermittent periods of relief, people have remained secluded in their own homes and hence have had no natural exposure to COVID. The people who've not had the disease, which is a vast majority of people, have not developed antibodies because they have not been exposed to the disease, remaining secluded for long periods of time. The vaccination program ran on an average manner in China. It was their own indigenous vaccine which they vaccinated their population. And if you compare the 95% vaccination with two vaccines in India, the percentage in China was far lower than that. And I won't quote a number because various agencies report various numbers in China, but it's far lower than the 95%. The Indian population, on the other hand, has had COVID as a community disease for the last 1.5 years or so. People have been diseased, so including myself, I've had COVID thrice. There's various people who have had COVID even more number of times. The indirect exposure, especially for healthcare workers, but for the entire population, has been humongous. And we spoke about the very successful vaccination program in India, probably the most successful in the world. So you have a reasonably antibody naive population in the Chinese, and you have an opulence of antibodies in the other population, which is the Indian population. So I believe that the antibodies will protect us against severe disease, against hospitalizations, against intensive care admissions, against deaths going forward. Can there be a surge of cases? I think there can be a small surge of cases. We will keep having small peaks, not the large ones like we had during the Omicron wave in India between January and March, but smaller ones. But these peaks will keep coming. And to be honest, DB, these peaks are there even in other disease processes. So you have them in influenza every year. You know, you and I have got used in our own countries, UK and India. We've got used to having these peaks in India, UK, US, even China. We expect it to happen. And that's why you've got a vaccination program for influenza when the peaks of influenza happen in these individual countries. So COVID will be no different. Hopefully, it will be less severe as compared to what influenza is. What about the UK? I think in the UK, the condition is somewhere in between where China is and where India is. In that, the isolation has been slightly greater. It has been of a slightly greater magnitude. However, of late, in the last 1 year or so, there's been a lot of intermingling of population. So while the number of cases are greater, however, the cases are minimal. And I think rightly, the UK has adopted a policy of no further isolation, get on with work, treat it as a normal cold, so that the people get antibodies off and on by getting very mild disease, which gives a spike to the antibodies, and that's sustained over a period of time and gives you immunity. So I think, answer to your question, I've given you a very long-winded answer to your question, but answer to your question, I think India, the way we see things now, will have a small increase in cases. The cases will be mostly mild and very mild. The Chinese situation is completely different, and they will have to reach this stage where they have gone from complete lockdown to complete independence, where people will get herd immunity, but it will be at the cost of a few thousand lives for sure, because their immune status will mean a lot of these people will get severe disease, will need oxygen, will go into hospital and ICU and die in some cases. So that's the difference between the two nations.
Thanks, Raja. I mean, this is extremely valuable information that you're giving us. I mean, from the look of things, would you actually advocate another booster dose to the people who are already vaccinated, and the people who are not vaccinated, would you advocate them to actually go and get themselves vaccinated? So what is your view on vaccination at this very moment?
So vaccination, I feel, is one of the most important tools there is against any respiratory viral illness where a vaccine is available, including COVID. Now, what about vaccination for people who have not taken the booster, the third dose? I think if you've not done it, you have done something which is negligent. You should waste no time and go and get it. So that's the short answer to people who've not had a booster. What about people who've had a booster? What about the fourth dose? Now, there are two aspects to vaccination for COVID. The first aspect is your own protection. You know, you get vaccine, you have a spike in your antibody levels, and you feel safer. Well, you don't feel safer, you're actually safer from the disease process. So that's one. The other important mandate is that the government recognizes the vaccination, says that you're free to travel during times when COVID spikes like now, and international travel, your recognition with a COVID certificate becomes a very valuable thing, especially for the upwardly mobile population, the younger population who travel from country to country, be that professionally, be that for pleasure and so on. The problem is that till now, we have not had a mandate from the Indian government for the fourth dose of vaccine. We are still waiting. So for people who are high risk, people with comorbidities, people who are elderly, if you've been vaccinated more than 9 months ago, I would advocate you go and get a vaccine. It wouldn't get registered. It wouldn't go on the COVID app, which is the Indian app for registering for COVID vaccination. You wouldn't have a certificate. But then the certificate probably is lesser important for this population who would be traveling less and would definitely not like to take the risk of traveling in the middle of what might be a small spike in COVID cases anyway. So I would advocate they get vaccinated. Healthcare workers, people who are high risk, so people like myself who probably are in the forefront of all respiratory viral infections, bacterial infections, I think it's wise for us to get vaccinated. I think it makes sense to do so. Otherwise, people who've not been vaccinated for at least 1 year probably need to think about going and taking the vaccine, especially if you're living with family, with parents who are elderly and high risk. You know, if you get the disease, you might get away with a mild disease, but you go home to your parents who are elderly, multiple comorbidities, the diabetic, the hypertensive, the ischemic heart disease, kidney disease, and you give them the disease. They have not traveled outside, but they get the disease and they get devastating disease. So I think that's the other group of people who probably need to keep themselves safe, not for their own sake, but for the sake of elderly folks who they live with. So that's the other population where I would strongly advocate a vaccine. Now, what vaccine? I think that's also a pertinent question, DB. The problem is that since we started off with vaccination, with the Covishield, with the Covaxin, etc., the vaccine was created against the alpha, the beta, and the delta strain of COVID. The vaccine has mutated many a times since then. And the current form of the virus would be very, very different to what it was when the vaccines were manufactured. That is why when you have the influenza vaccine on a yearly basis, on an annual basis, you reconstitute the vaccine according to World Health Organization recommendations every year to cover the mutant strains for that particular year. And you have separate vaccines for the northern and for the southern hemisphere. Something similar is happening with COVID, but it will still take a little bit of time. In the meantime, you would know, DB, there's an intranasal vaccine which has come into being in India. It's just been licensed by DCGI, and we are the first country where an intranasal vaccine has come into being. So a couple of things I think your audience, our audience would find interesting about the intranasal vaccine. So I'll come back to the intranasal vaccine. But the intranasal vaccine was formulated during times of Omicron. The trials were during Omicron. So if you have to take a booster now, it actually makes much more sense to take the intranasal vaccine, which is a more updated vaccine, so as to say, against the more recent strains as compared to what the Covishield and the Covaxin is, which is a older strain designed against the older strain of the virus. Why intranasal? Why do we think about intranasal vaccines? So all of us know that the nose is the port of entry for the virus. The virus replicates in the nasopharynx. Hence, if you put a vaccine within your nostrils, it trickles back and there is local immunity which protects and reduces viral replication in the upper airway. If you manage to do that, along with the systemic effect of developing an antibody, you also have the local antibodies which develop around the nose, which neutralize the vaccine at source. The nasal immunity actually wanes faster too. So we have seen that with the Covaxin and the Covishield, the nasal immunity actually lasts you for no more than about 6 to 9 months, whereas the bloodstream antibodies last you a year. So that's why the intranasal vaccine is started in India, and we are proud that it started in India, but it's going to be something that will be looked upon by the world as a safety gadget going forward throughout wherever COVID is still prevalent.
I think this is amazing information that you're giving us, Raja. But one thing that the pandemic has taught us is that you're not just responsible for yourself, but you're also responsible for people around you and the community. So what is your message, especially regarding the precautions that we take, like physical distancing, masking up? Is there any need of doing something of that sort? Do we need to go back to masks? Do we need to physically distance and be very careful as to how we present ourselves to society? What is your views on that?
That's a great question, DB. Great question, because the mask is no longer a mandate anywhere in the world, to be honest, maybe other than China. So it's left to your personal choice. Whenever something is left to a personal choice, there's a responsibility which gets shifted from the government, gets shifted from the healthcare workers to the person, the individual. So it's more challenging. So I would, especially at the current, as things currently stand in the current scenario, I would recommend masking in crowded places. I would recommend masking in stadiums, in sort of malls, cinema halls, people where there's a lot of people around, crowding around, especially in the high-risk population, or especially if you're going back to a high-risk population. Healthcare workers should mask in crowded places for sure, because their chance of transmitting infection would be even greater. It's not just to their parents, it's also to the workplace where they work, where there's a large number of comorbid people who would come and visit you and see you and seek your advice. So I would advise masking in those places. The other place I would definitely advise masking is at airports and on flights, DB, because I think it's international travel which is going to spread this disease all over the world. It will spread, but the use of the mask will ensure that the spread is kept at a minimal level if we can maintain masking ethics, masking etiquette in airports and during international travel.
Absolutely. I mean, this is amazing information that you've given us, Raja, so detailed. And I think I would actually come to the last question. So finally, Raja, so there's no cause for panic. I mean, that is usually what happens as soon as we hear coronavirus. So there's actually no cause for panic. It's just we need to be a bit sensible about coronavirus. So what is your final message to our listeners today?
So, DB, my final message is that yes, there's no cause for panic, but there is caution is important. You know, we have faced a pandemic which comes once in a century or even more infrequently. And it's unlikely that we'll face a pandemic again. But we will face epidemics. We will face epidemics of other respiratory viruses like the influenza we were speaking about. And there are learnings that we have taken from COVID that can be extrapolated to other conditions like the influenza, like tuberculosis, like protecting against air pollution, and so on and so forth. So take the positives, try and ensure that the level of safety that you have going forward is maintained at a higher level as compared to what you had pre-COVID. That's the positive impetus you take from a pandemic. There's very few positive things you can take from a pandemic, but make this one. I think panic is not necessary at the moment. Hopefully, there'll be no cause of panic from COVID even in the future. But if we are prepared, if we are cautious, if we take the positive learnings forward, probably there'll never be cause for panic, even from diseases of a similar ilk going forward.
Thank you very much, Raja. This is amazing information. This is amazing teaching. A lot of things that I've learned today, and it's very typical you. And the one last comment that I'll make is thank you very much, Raja, for all this information, and with the message that there is no need for panic, but there is a need for caution for all of us, whether you're in the United Kingdom, China, India, and all over the world. And with this message, I shall now conclude this interview. Thank you. Thank you, Raja.